Hello everyone, this is Dottie from Dot Games, or Tamara as you may know me, IRL. I'm here to talk to you today about brain injuries. A lot of people don't know a lot about them, or are just uninformed. Maybe they need to be educated, or maybe they know someone recently that has hit their head and they're looking for a little advice on what's going on. A traumatic brain injury, so to speak, is an injury to, like, the skull, the brain, the scalp. Usually an impacted sort of thing, but, like, happens a lot in sports. It happens, a lot, like, in the workplace. Sometimes just out and about, doing your everyday thing, bump your head. A little bit later, you don't feel right. But, like, concussions and head injuries, they're a serious deal. Like, I think it was in 2008, a survey revealed that there was anywhere from 1.6 million to 3.8 million sports-related traumatic brain injuries, like, per year. And if you don't think that's a lot, then this video isn't for you. And these injuries, they can do a lot of things. They can, well, they can alter your sorry, I got a bunch of these myself. They can alter your mental status. They can disrupt the normal functioning of the brain and change it so that it's just not functioning normally. Multiple concussions can lead to life-changing alterations to the way that your brain functions and works. They're very, very serious, especially if you've had a few of them. Then you really got to start taking care of yourself. Other, traumatic brain injuries include, like, what do they call that? Hematoma? It's like your brain's bleeding and it'll clot. Skull fractures, and that should be fairly obvious what a skull fracture is, and contusion, which is a bruising, in the brain. They can lead to all kinds of serious effects. So many, in fact, I wrote them down, because I'm a derp and I don't remember shit. So here we go. Yeah, real official, right? Your first signs of a traumatic brain injury, most like a concussion, the symptoms would include confusion, depression, a dizziness or loss of balance, feeling foggy or groggy, memory loss, that's an easy one, headache, sometimes you'll have double vision or fuzzy vision, a sensitivity to light or sensitivity to noise, difficulty sleeping, nausea, issues with your concentration and your memory. And if you have these symptoms over here, it's a sign that you might have something worse, and they're going to definitely want to see you at the ER ASAP. These symptoms include a change in your pupil size, if you're leaking like a clear or bloody fluid from your eyes, your ears, your nose, your mouth, any orifice really. Random irritability. My last concussion, I suffered that a lot more than I was used to, and I didn't much care for it. A loss of consciousness, that's a clear indication. As soon as you lose consciousness from a blow to the head or anywhere on the body, it's pretty much, by definition, you have a concussion. But the loss of consciousness could mean other things. Could mean a skull fracture, bone poking in there. Could mean all kinds of nasty shit. Your face could bruise up, which it probably means you're bleeding somewhere in there, and probably should get that looked at. If your blood pressure suddenly drops, that can be a nasty sign. Inability to move limbs, that's a no-brainer. Go seek help immediately. Sometimes you can lose your senses, like smell, hearing, taste, and touch. A lack of coordination, just, you know, because you're probably dizzy and having a hard time staying upright. A stiff neck it's an interesting one. It's a sign that, yeah, you took quite a blow to the head, even if you didn't lose consciousness. If your neck is getting stiff, you got some issues there. Get it looked at, please. You can, like, severe vomiting. If, like, you're throwing up all of a sudden after bumping your noggin and you can't stop, you need to go to the ER. Severe headache, it's much like the regular headache, but more migraine-y. It'll probably come with the sensitivity to light and sound and stuff. It's important that you recognize that one. And swelling of the injury or just your head in general, not a good sign. Please go seek help. What do you do if someone you know at the sporting event, you know, like maybe you're playing basketball or baseball or soccer, or maybe you're biking with friends, maybe you're at work, or maybe you just see someone out in the street fall and bump their head and they're displaying some of these signs. First thing you need to do is convince them to go to the ER and get checked out. Now the doctor's there. I've heard a lot of people complain about this. Personally, I think it's a good thing. It's a good thing to always be protective and careful when dealing with brain damage or brain injury. I've had like double-digit concussions in my life, and I had a severe one when I was assaulted, and that caused me some brain damage, and my brain, simply put, does not function near as well as it used to anymore. Very, very important. You play it safe and you take it careful, and when you figure out that someone's probably got one of these, you want to take them out of action. Yeah, McDerp, you know, memory loss, difficulty concentrating. I figured these videos would be much shorter if I just took jot notes. Take them out of, you know, take them out of action. Remove them from the work site or take them out of the sport. And you have to do this. Like, it doesn't matter how short-handed you are or that your team may lose the game. The person's safety should be the most important thing on your minds. A lot of people don't take concussions and traumatic brain injuries as serious as they should, and I assume it's due to a lack of education or knowledge. Hence why we're doing this video today, maybe help some people out. One thing to note is that death from a traumatic injury in a sporting event or at work or at home, death from it is rare. Like, our treatment has gotten so much better, and a lot of the times a concussion will be minor. But, what did I write? Oh, yeah. Sorry, concentration, memory. But brain injury, at least in sporting events, is the leading cause of death every single year. So, if you're just looking at this for advice for sports, take your concussion seriously. Get yourself out of action. Don't worry about the team. They'll do what they got to do. And one thing a lot of people are not aware of. When you get a concussion, you are to be removed from the game, from any sporting activity, from work. You are to be removed from this, and it can be for weeks. Literally weeks. The bare base minimum. You'll get these little concussion impact cards if you go to the hospital. If you read all the steps, it's a week. Bare minimum. And that's assuming you recover immaculately. The more concussions you have, the longer your recovery is going to take. If you've had multiple concussions, or you have a severe concussion, it can take longer. Literally, and you can look this up, it's the truth. You can look it up. It can take months, and in some cases, years, to recover from these concussions. Number one on your priority list should be your health. Because if you get sudden impact syndrome, where you suffer a concussion while having a concussion, there's where you're getting into your fatality rates. That's when shit gets real, so to speak. think that's all I have to say. I hope this educated you in some way, or maybe if you know someone that's suffering, or suspect someone may be suffering, maybe this helped you. I don't know. But I've noticed through my personal journey a lot of lack of education on head injury, and I wanted to help out as best I could with a short little 10-minute video. So, like, comment, subscribe if this helped you out, or if you find this useful in any way, leave me a comment, tell me what you think. And until next time, this is Dottie saying, bye-bye.